Hello, listeners. Welcome to MHT Conversations. This is Havisha, your host for today, and we have a very special guest with us for Autism Awareness Campaign, Miss Chandralata Sharma. Welcome, Miss Chandralata. How are you?
Thank you. I'm good. I'm good, Havisha. How are you?
I'm good too. Thank you. So,
Yeah,
for our
thank you for
listeners,
inviting me.
yes, we
Thank
are
you for
very,
inviting me for the talk on
yeah.
this autism awareness campaign. I've hardly done anything, but thank you so much for inviting me.
We are glad that you have agreed to come on board, and we are going to talk about and get to know a lot more from your experience about how do you deal with parents, how do you deal with kids of autism, and the topic that we have for today is that how early and easy diagnosis can help manage anxiety of parents who have autistic kids. So, for the listeners, this is April month and it is autism awareness campaign going on with MHT, and hence we are inviting professionals from various areas who have dealt with adults or children with ASD, and who can talk about from their experience as to how to help them, how to help the families, and what can be done more to make this society more inclusive, right? So, before we jump into the topic, I'll introduce Ms. Chandralata. She is a private clinician dedicated to treat children and adults with speech and language and or swallowing problems and to optimize their potential. She has opened a center, Aakaar Child Development Center, in 2009, and it looks at every child holistically. Every child has its unique strengths and weaknesses in regard to his thoughts, perceptions, behaviors, emotions, likes, and abilities. More about the same, we would like to know from you, ma'am. You can let us know about the work you do. You can let us know what Aakaar is.
Um, uh, Thank you, Havisha. Thank you for this lovely introduction. I'm glad to be with you today on this autism awareness campaign.
Yeah,
Uh, it's been a lot this month. I couldn't do much because of the various things happening in my family because of Corona. But
yeah,
tough time for all of us
of course.
amid this second wave of infection. So, but apart from everything else, when we look at the autism and the autism, the whole structure, the therapies are so important. The therapies and
Yeah,
the parts of it, and the child is so important. The parents cannot take a break. The parents do not, they do not have the luxury. It's almost a
yeah,
year there is no treatment, and a project like this, a project where the parents can understand this, the whole process is quite important.
yeah.
So thank you for meeting me, and we can start our conversations. I built Aakaar with a couple of my friends in
Okay,
2009,
okay,
and uh, now it's totally with me.
okay.
So then we've been working. My basic, I'm a speech language pathologist by profession.
Professions. Yeah,
So, I look into more towards the communication development, the speech and language development of children with uh, autism. This so
okay,
along the spectrum. So now we in Aakaar have an occupational therapist. We have special educators. We have NIOS. We also have speech and language therapy department. So there are different departments now. As in for our autism diagnosed child, we require a good autist. We require good speech
correct.
therapy. These are the crux of any therapeutic treatment or intervention which is being given to a autistic child.
All right.
So that's what is happening at Aakaar from 2009.
All right, all right. That's great. So you have collected a team of professionals who are required to help develop different skills of a child on the spectrum. Yeah.
Yes.
That's great. That's great to know, ma'am. So, you have been working with parents and kids with ASD, and working on their speech and communication, as you mentioned. So, other than the social skills or the communication deficit, what are the other traits that are visible on, kids diagnosed on the spectrum?
See, we have like for in India, we have the MCHAT, we have the Indian Autism Rating Scale, we have the
Okay.
DSM-5 criteria, we have CARS. These are a couple of batteries which are used to diagnose a child with spectrum. Now,
Okay.
in this case also, there are various parameters on which all these scales are developed. So majorly, if you ask me, like say when parents go for a diagnosis, so
Hmm.
initially they know the pediatrician. Okay, they have their pediatrician. So once
Okay.
they've spoken to the pediatrician informs them. Okay, they inform the pediatrician such behaviors are being seen. Our children are not they're not speaking, they're not pointing, or they do not
Correct.
follow our instructions. They do not follow any kind of a proper play behavior. They're busy with their toys. They do not give us eye contact. So these are a couple of huge pointers, lack of eye contact, lack of
Correct.
following commands, lack of
Okay.
developing appropriate play behavior, or there is sometimes excessive crying, excessive
Okay.
laughter, or inappropriate laughter and crying, I would say. So these are
Correct.
some of the behaviors which parents report to pediatricians. Now
Okay.
after reporting that to the pediatricians, when you report to them that, like say a 1.5 year old child has not developed any strong communication pattern, or probably not asking for food or toilet or anything like that, so
Correct.
then the pediatrician refers it to a developmental pediatrician, and then
Okay.
the developmental pediatrician is the one who kind of studies this entire pattern of behavior in various categories. So after their intervention, the child is actually diagnosed as an having autism, or not under the spectrum, or any other diagnosis, any
Correct.
other child deciding behaviors.
All right. All right. So then it comes to you, and you work on the developmental milestones which might have been missed or needs more, skill development in order to reach there, right? Yeah.
Yes, very true. When the child comes to us, see the child, because of the lack of eye contact and the inappropriate behaviors, a lot of sensory issues that you see in the children, they're
Correct.
moving around and they're not settling down, or inappropriate play behavior, inappropriate any matter, any amount of communication. A huge number of children who come to us are with the lot of sensory issues, like hand slapping is there. Then
Correct.
again, they're just having something in their mind and playing with that.
Correct.
Sometimes there is too much of a sensory overload. So even if a person tries to communicate with the child, or that person tries to say something to the child is not in the frame of mind, or in the frame of to accept any information coming to them. So
Correct.
it varies, and Avisha, it varies. It varies. Like some children
Okay.
are quite compliant. Some children, if you tell them say ABCD, they will say you ABCD. Some children,
Correct.
if you try to teach them 1 2 3, they will also learn 1 2 3. There are some children you can teach them colors. Some children are ready to learn, but
Correct.
different children have different behaviors. The most important aspect in this, I would say, is the child giving adequate eye contact. When you're doing work, do you have to actually take eye contact from them,
Correct.
help them follow commands and things like that. Sometimes the parents think that they could work through this, हम लोग ये सिखा लेंगे, हम लोग ये सिखा लेंगे.
Correct.
But sensory difficulties or the sensory overload, the sensory experiences, these are little on a higher term, but the way the sensory learning is happening is very, very important for the child. Once the
Okay.
child undergoes occupational therapy, sensory integration program, then only the child is ready to accept communication, speech and language patterns, speech and language stimulation. Okay, so the first and the foremost step is occupational assessment, occupational therapy assessment, and to start with sensory integration program.
All right. All right. That was very useful information from your part. And this makes me wonder the whole process that the parents has to go through, if they find any differences in the child, the communication lagging or the eye contact or following of command, as you mentioned, and they go to a pediatrician, then they go to a development pediatrician, then they come to you. I'm just, imagining how much uh, confusion, how much stress or anxiety parents might be going through. So, in your experience, what's the reaction that the parents give, when they come to you?
many a times, Avisha, I don't want to be the first bearer to say this news to them. I really don't want to be. I need to inform a parent that your child is diagnosed with autism or it's under the spectrum. So I really avoid it. But somehow you have to be frank and somehow you have to be truthful to guide the parents to the new the new aspects, the aspects of therapy. So you have to be straightforward, you need to be truthful. Many parents have come to me saying that we were not informed by the pediatrician, we were not informed by so and so person, we went to this homeopath about the behavior and everything. They did not tell us about it. So then I feel what is happening to our society? Aren't we supposed to inform the parents, tell them if something is there, so the child gets the treatment at the right and the appropriate age? Avisha, in all of these, the intervention is very, very important. So early intervention is the key to all the therapy. So if at all, like as I would say, a parent, when they understand, okay, fine, now the child has a diagnosis along the spectrum, they need to, the denial, the grief, the pain, or the sadness that they go through, and there's sometimes like a big this not happening to me, this is not, this is not what is going on. So this whole thing needs to be taken in, sucked in, and looked into, that I need to work with my child, I need to do therapy with my child, I need to take a proper professional intervention that is very much needed.
Correct. So that I think that comes when the parent is ready to accept it and not in denial and not worried about what the society is thinking and how my child is going to be labeled or anything like that.
Many a times it's always also a blame game that goes on. It's from your side, it's from my side. Nobody has any disorder from my side. How did this disorder come into our house? As if we are two different people. So there's a lot of blame game also between the parents. But over the period, so all these things, like say, first not accepting the, I've seen parents, it's like as if it's something fleeting. It's like a thing which they all go through, so it's like denial, grief, pain, sadness. But then from all that, some mothers I have seen to be very strong, in that particular moment. Okay, fine, this is what has happened to my child. Okay, tell me, ma'am, what to do next.
What can I do? True.
What do I do next? Okay, what you've told me, I understood, ma'am. Okay, I understand my child has this problem. But what do I do next, ma'am? Do I see? So then it's like, then I tell them, okay, fine. Maybe they've read it. Maybe they've been searching about it. Most of the parents I know nowadays, we have our Google Baba.
Yes.
Everything
yes. Everything is available.
Sometimes I feel some parents are aware. Some parents, it may cite as a shock to them, or they may, take it as a big this. Obviously, it is a very big, it's a very big change, a turn in their life. There are various aspects and there are various desires to have a certain kind of a child or a certain kind of, expectations that they have. They have a boy, they have a certain expectation. I had a girl, then their expectations change. Oh, what is going to happen next? And what are we going to do about it? She's not even listening to me. She's not giving me eye contact. What's going to happen to her? So all these things a parent goes through. But some parents seem to be literally very strong. As a father, as a mother, they take charge, So I really know those parents, they take it. Okay, fine, something wrong is like this. It's like if she had a fracture or if she had something like this. So fine, okay, ma'am, now let me take care of this.
Correct.
Let me get my child to a very good level. Obviously, you're going to feel all this in space, in time. It's all going to be coming up. But do not forget the site of therapy. Do not forget the site of asking for help. Do not forget the site of doing the right for the child. It is very, very, very important.
Correct. Yeah, this just makes me want to say that, whoever is listening to us, and if they are a parent or any caregiver around a child on spectrum, please, think that it's not child's fault that he or she or it is that way, and you have to accept the
Havisha,
circumstances.
it's not anybody's fault. It
Correct.
is
It's not
the
anybody's fault.
it is- if you see in this corona times, very small children have been at home, so
Correct.
they have been like the mothers have been busy in the kitchen or in their work, or
Correct.
the fathers are busy on their laptops, the children are busy watching TV, like say 12 hours, 13 hours, 14 hours a day, and the
Yeah.
mothers then start cooking. So all these things, you must understand there are repercussions to it.
Yeah.
Watching so much TV, watching so much of getting to play by self. How much are you interacting with your child? How much are you encouraging your child to play with you? How much are
Correct.
you sitting and playing with them? So
Yeah.
time and tide are like this, wherein we are seeing a lot of cases in corona, especially during this time last 1.5, 2 years. I'm seeing like 1.5, 2 year old children having it, and at least I have seen 4, 5 kids. Imagine. So
Hmm.
it's been like it's a tremendous rise also. So
Yeah.
it's nobody's. I don't feel it is
True.
anybody's fault. The child may be having something. Autism is like a neurological behavioral disorder. So
Correct.
then you must understand that some factors or something must have triggered in the child to the child having this disorder. The most important part is early intervention.
Correct.
Early intervention is key to where you can get your child back, and you can get
True.
the maximum out of your children. Some of the children, if it is just started, it may come out of it. You don't know.
Correct.
So all you think of is starting therapy and intervention as early as possible.
True. True. So you mentioned that they go to developmental pediatrician, and they if they find these lags, differences, they come to you, and so what's the process of this early intervention that takes place once the child or the parent is with you?
Initially, I would say ki if the child is B to a developmental pediatrician, then good enough, because then the otherwise one of the faculty members that we have at Aakaar is Dr. Ankita Patel. We start with the assessment, the entire child behavioral
All right.
assessment. Her. She does the MChat. She does the whole autism diagnosis. She studies that. See, they don't start off with yes, the child has autism, but it
Correct.
all depends on what is the checklist and how many pointers that the checklist the child is able to is ticked on.
Correct.
So the developmental pediatrician will first map the development of the child, the fine motor, the gross motor, the play, the socialization, the speech and communication patterns. So when did the child develop? What are the behaviors that the child shows desire or different from a normal growing child? So
All right.
then again, they find out these behaviors, they map these behaviors, and accordingly the child is sent to us. So first we start with occupational therapy assessment. So we have Dr. Pranjali, then we have Dr. Sonal. There are 4, 5
Correct.
autists with. So then they all start with we start first with the detailed sensory integration, sensory profile, what we call
Okay.
a sensory profile. So a sensory profile is made of the child. Now, what exactly is the sensory profile? It is the way the senses react. Okay. So when the child gets like, if you say, how does a child react to a light? How does the child react to a toy? How does the child react to any kind of a touch sensation?
Correct.
Does it all depends, like what is the play behavior of the child? So they a lot of parameters in sensory profile are being checked, and what is the and according to the conclusion of the report, the sensory integration plan is made by the occupational therapist, and then they start with the sensory integration plan. In speech and language therapy, we generally try to see the development of speech and language behaviors. Then we go on to see what communication patterns can be strengthened. There has to be some or the other way the child is trying to communicate with the parents. for
Correct.
food or something. Sometimes taking their hand to the particular food item, sometimes taking or taking them and showing to that that at the pot of the water, yes, I want water. Or sometimes taking the bottle and giving it to the parent. Now open the
Correct.
bottle and give him water. So these are, we try to study the present communication patterns, and then we devise a plan to develop further how to kind of help the child to develop further communicative
Communication skills.
devices that the child can be used with the environment.
All right, all right. So it's very individual in nature as to where the child is standing, how much more is required, what type of learning is happening with the child, whether it's
Mhm.
audio,
Yes,
visual,
yes, yes,
reading
yes.
ability.
Basically, a sensory profile is the one which gives us a clear picture as to how is the child sensorily learning, and what are the sensory difficulties that the child is facing.
Correct,
So then a lot of role, once the occupational therapist, once you have a good occupational therapist working, then again you need a good speech therapist to work with their child.
correct,
And one, an amalgamation of all both of them can really take your child through to a lot of hurdles coming along.
correct, correct. All right. So now that we have talked about how intervention takes place with the child, how do you deal with the parents, anxieties about like what's going to happen to my child, or we did talk about the blame game or the initial phase when they get to know about it, or when they are in the process of getting them diagnosed, or just checking the level as to what more is required. And if they come to acceptance, I'm sure still parents will be, or the extended family members also sometimes, that they go through a lot of stress in terms of how the schooling is going to happen, how the child is going to be independent if at all the skills are lacking in that manner. So how do you intervene with parents and the caregivers around the child?
See, I would say one step at a time.
Okay.
So now just means once they start with the therapy, I keep giving them a weekly report regarding how the speech and the OT is functioning, how the
Okay.
child is doing. As much as possible, once the child is settled in, we make the parents see therapy at least once in a week, so that they start sitting, they start working at home also with these activities, which is very
Yeah.
important. So even if you are doing like 1.5 to 2 hours of therapy in the clinic every day, you still go home and you do certain amount of 1 hour, or one, at least minimum 1 hour of therapy twice in a day with the
Okay.
child, so that the child also starts learning with you. So
Correct.
that is one way of doing this. Sometimes it may so happen that the parents do not get the time, or they do not make that much effort, or the child is not ready to learn with them. So do
Correct.
not get discouraged, do not get disheartened. The child might take some time, but
Correct.
once you start, even if you can't do or you don't work well with your children, but dance with them, paint with them, color
Correct.
with them, clay work with them, do
Yeah.
sand work with them. You don't have to be a therapist to work with your child.
True.
You actually have to give them learning experiences. So even if you play and take a clay and make mango, apple, banana, boat, that's also good enough. That's
Yeah.
a sensory experience. That is a
Correct.
proprioceptive experience to the child. It's an auditory experience, visual experience to the child. So you have to work with your children, get down to the childlike level. Your child loves clay. Most of them love clay. Most of them love sand. Most of them love paint work.
Yeah.
So they like messing sometimes. They like the messy play. So work with them along with that. So I encourage the parents to play with their children before you
Okay.
actually start off therapy. See, they're already doing a certain amount of therapy. The child
True.
may not do therapy with you. So, but why don't you at least start, working or getting some learning experiences with your children again? Another
True.
part that I would encourage parents into looking is to having always once in a week or once in 15 days a sit down with their therapist to know what exactly are the goals, and
Correct.
what planning is being done. A proper therapy plan is the key to any kind of an appropriate any plan.
Correct.
So any therapy, so then let them have a proper 15-day 1 month program from the therapist. What is being tackled with my child
Correct.
at this point of time, and
Yeah.
accordingly the therapist explains. I talk about diet. I talk about, what kind. So many of them are on bottle feed. So many of them are on, like say the mother's feed. Trust me, 2.5 year old who come to us, like mothers think they can be fed till 3 years of their life. So
Correct.
all this is uh, all this is complementary to develop of communication sensory. So like stoppage of mother's feed, stoppage of bottle feed, getting
Correct.
the child to have a proper a diet, there should be no less of carbohydrate, less of the sugary
Sugar.
products.
Yeah.
And sometimes the children love to binge on the wafers and everything,
True.
and the proper diet is lost. So to have a good protein diet, what we say, is extremely important for these
Important.
children. It is related to their sleep patterns, it is related to their
Correct.
in unamountable crying, and these other emotional feelings and behaviors. So we
True.
believe that once I meet the parent, I holistically guide them in all the aspect of the child development. Again, if
Correct.
they need any other extra help or anything, I guide them as well. What some of the parents have been seen is that mothers getting a bit overwhelmed with all these
True.
things, like,
Yeah.
because she starts getting these calls, oh my god, your child is being diagnosed,
Yeah.
so like what is going to happen, her mother says, her mother-in-law says, the husband is busy working, but the mother is the
True.
one at the receiving end. So I feel the mothers are usually the bearers of this whole traumatic experience that a child goes through. And then again, a therapist is their only solace, or a
Correct.
therapist is their only guidance is that they have.
Yeah.
Some of them have referred for counseling, some of them have referred for antidepressants also, but
Okay.
I believe that even taking one step at a day is what you
True.
can think about. You cannot
Yes.
decide tomorrow your child is going to be, what your child is going to be. Or
Yeah.
I try to make them see young Sheldon is there, young
Yeah.
Sheldon is there. You have, like, Big Bang Theory, you see how Sheldon behaves. It's a
Yes.
very good experience. You have a good doctor on Sony Live.
Correct.
It's a extremely, he's an Asperger's. So there are
Yes.
various there are various uh, we do encourage other parents of elder
Create a
autistic children
support.
that have had it. My no, my or the one I've treated is already passed, is in 12th standard right now.
Okay.
So I feel very proud that I kind of treated him, and he's so good. He was
Great.
extremely intelligent, and some of them are doing excellent piano players. Some of them are very good judo players. So we see a lot of changes in them. I've seen
Great.
their parents moving through n number of emotions, and there are times why they did not settle in India, why they were abroad, and many other things. And parents who
Great.
are here, and the scholastic uh, weaknesses or whatever behavioral difficulties that they have been through, not scholastic weakness, I would say the behavioral difficulties that they went through, how helping their children with the school work and everything. So
Yeah.
it's a long journey, and to
Correct.
start the journey, it's one step at a day.
True. True. Very
One step,
nicely
one
said.
step
Yeah.
at a time, I would say. One step at a time is
Time.
the thought a parent can have. And as and when it comes, discuss with your therapist, seek your
Correct.
therapist help. I'm sure your therapist will help you.
Correct, correct. I guess sometimes parents also form attachment with the kids' therapists because they see how much they are doing for the kid, how much the kid is progressing. So they feel they can also get the same help for themselves. And that's great because in India, especially, adults who don't go out for therapy, they don't go out for themselves. And that reminds me that self-care is so important for parents. And as you mentioned, one day at a time, and one step at a time. So for that, I feel self-care is very important. If they are taking care of themselves, they'll be better able to take care of their children, of other family members, and the society in general, who is so tabooed about discussing these
And
things.
I would say कि nowadays 1 in 68 children is having an autism. So it's okay. Many children are there with silent disorders. We do not know. We find so many LD. We find so
Yeah.
many slow learners. We find n number of difficulties with children.
Difficulties.
So it's
Yes.
okay. It's a part of the society. Maybe in your family there may not be, but there could be someone in your neighbor. There could be someone in your neighborhood. Again, that is why we need such autism awareness campaign,
True.
so that
True.
parents, other people do not take it as a taboo. Oh, there is something
Correct.
wrong with this child. Oh, there is something this with the child. It's okay. It's fine.
Yeah.
The child is not coming to harm you or anything
Of
like that. The
course.
child, these children are the least harmful ones
Harmful.
who could have. They get more scared. They are like little puppies, and so they just need love and care
Love and
from
care.
the society and the
Definitely.
environment. I'm sure they will all get along very well with others.
Yes.
I haven't seen any autistic child hurting anyone.
True.
Not hurt as in, unless and until the child is being disturbed or the child
Correct.
is being prodded.
Yes. Yes.
So I
That's
think
true.
it is the normal children are more aggressive rather than
Correct.
these children. They are more timid in nature, I feel.
Correct. Correct. Yeah. Yeah. So just focusing on, I would like to give out this message that please, parents, caregivers of children on the spectrum, take care of yourselves. And I know, as ma'am has mentioned, take one step at a time. We always say that, पहले mask खुद पहनो फिर दूसरे को पहनाना oxygen के लिए, so that you are there capable enough to take care of someone, in the need. And for that, I have a very nice recommendation of this app known as Aakaar Meditation. So it basically provides, individualized, custom-made yoga programs for yourself, your better sleep, managing your anxiety, and it has guided meditation. So sometimes not only for yourself, but even for kids, if they like listening to calmer music, if they like listening, watching some calm visuals, this app is great. I would like that all our listeners check that out. The description is given in the comment below. It's Eka meditation app. It has scientific backed up research, yoga mudras, like for chakra shuddhi, gentle practices, body relaxation, and likewise. Please check that out and give us your feedback if you like using this app. And you can always take guidance from the teachers who have made this content on the app. They will provide you proper holistic guidance, individualized, so that it's best fit for improving your mental health, physical health, overall well-being, and as well as your child's. So that was a nice recommendation from MHT that I feel you all should check it out. And getting back to ma'am, we did talk about how you help out children, how you help out parents, and it's again, it's one step at a time, and the whole process. And it was a very nice point that you mentioned, and I forgot to point it out, is that well informed parents are less anxious. So as you told that they should have an interaction with the therapist every 15 days or something, to have a goal plan for the child, do the same implementation at home so that the child is in sync, and keeping all the caregivers in one proper set of loop of informed about the child's therapy that is going on. I think that lessens the anxiety on both the parts. So any, last message from your side, ma'am, about this autism awareness campaign that we are holding, about the work you do, which you want to, reach out to the audience that's listening to us today?
I would say कि parents are the best advocate to their children, and strong mothers give rise to um, strong, well mannered, this strong, uh, strong the children. So what I would say ki, as mothers, as parents, be as a family, and together take care of your children. Take care that they do, get early intervention, get the best help possible in the whole in whatever society or whatever this you are living in the this whatever place that you live in. Make
Yeah.
sure you read well, you understand your therapies well, join support groups of
Correct.
autism campaigns, and this, so that you are well aware of anything that comes across. There's a lot of myths and facts regarding autism that you need to be well aware of. Do
Correct.
not fall into praise about this autism can be cured. Autism does not go away. The
True.
behaviors and the difficult the sensory experiences that the child do go away, but then the child can be fully managed. The child can start with normal schooling. The child can be a great learner. It
Correct.
all depends towards both of you. So you are the best advocates towards your children. Make sure they get good therapy. Make sure they get good learning experiences from the therapist, and the rest, I'm sure, lies in the hands of the person who's treating your child.
Correct. Correct. Very nicely said, ma'am. So that brings us towards the end of this conversation, and we were so lucky to have you on board, ma'am, to share this amazing, rich experience of your work that you have done. For the listeners, all the information about the speaker today and the center that we have talked about, which she has founded, will be available in the description of this video. Please reach out to her if at all you need any help. Please reach out to us if you want us to connect to her.
Abhisha, anytime any parent has asked me for anything in any
Yeah,
part of the this society, or wherever they are in Delhi, in Noida, I have tried to help out
correct.
parents in their own particular areas. If they
Yeah,
need any backup support, also we have said that we will provide you with. We've been having very good work experiences with Jaipur, in Delhi, abroad, UK, US. So parents have taken forward programs,
correct.
home programs, and done it with their children. Like there are times when in Dubai and all, you don't get very prompt treatment or very prompt this. So but the more you so on something like online therapy, it already started there. It
Correct.
has already been working. Luckily now we have WhatsApp, we have Zoom and
Yeah,
everything. But even in those times, parents used to come once in 6 months. I have plenty of parents who used to come in once in 6 months from UK and US, take a program, travel there, work with their children, come back, and then start with another program.
correct.
They used to carry books and cards and pictures and things like that. But it's only happening because they took an interest. They
Correct.
went in, then they asked for something more from us. So
Correct.
as parents, you can take those initiatives
Initiatives.
into getting the work done, or asking a lot of questions to parents, to caregivers, to therapists, and get their work done.
Yeah, that's very true. Very true. And hence, I would motivate all of our listeners, if you are around a child on the spectrum or any adult on the spectrum, or if you know someone who is, please refer, please reach out, please take this initiative to help them adjust better in our society and make this autism awareness campaign by MHT and various professionals who have come on board a success. So, thank you so much again, ma'am, for doing this today. And thank you, listeners, for tuning in today. Please don't forget to like, share, and subscribe our channel. And please reach out in case of anything you need help with. We'll make sure that we get back to you. Thank you.
Thank you, Harisha. Thank you for this wonderful experience. Thank you
Yeah.
so much for having me on board. Thank you.
Yeah.
Take care.
Take
Have a good
care.
day.
Take
Have a
care.
good day, all the parents.
Yes. Yes. Thank you so much, ma'am.